Amendment hopefully will be bipartisan. It's very simple. It would keep open the doors of the United States Interagency Council on Homelessness by extending the sunset date to October 1st, 2020. It would increase the funding to $3.6 million, which is consistent with FY17 levels. My offset comes from the HUD IT account. Homelessness is a very complex and multifaceted problem. I'm sure everyone knows that. It can't be solved by any single agency, level of government, sector, or system on its own. That's why the United States Interagency Council on Homelessness, also known simply as the Council, is so important. It brings together multiple agencies, including USDA, DOD, HHS, HUD, Department of Interior, Department of Veterans Affairs, OMB, Social Security, to improve federal collaboration in identifying high-impact strategies to prevent and to end homelessness. This type of coordination is critical in our fight to ensure that everyone has a roof over their heads. Through improved collaboration, it bolsters direct investments and interventions at the community level to end homelessness. With more than 46 million Americans living in poverty, and more than 500,000 Americans experiencing homelessness, we can't afford to close this council. Over the past several years, the council has been critical to addressing the epidemic of homelessness affecting our nation. In 2020, the council launched its federal strategic plan known as Opening Doors, which leverages local, state, and federal partnerships to address homelessness on every level. Their roadmap would address chronic homelessness and homelessness overall with the focus on veterans, families, and youth. This roadmap has helped the council reduce homelessness by an astounding 14% across the country. This includes reducing the number of people experiencing unsheltered homelessness by 25%. This means, of course, that fewer people are forced to live on the sidewalks, in cars, in parks, and other outdoor locations. It's also made real substantial gains in addressing their long-term goals. For example, the council's efforts have helped drive homelessness among veterans down by 47%. That's huge. They've also helped decrease family homelessness by 23%. This includes a 65% reduction in unsheltered homelessness among families. And chronic homelessness among individuals with disabilities is down 27%. Under the leadership of this council, 50 communities have now announced an end to homelessness among veterans. The statistics are clear. The council's on homeless Opening Doors strategic plan is working. It's on the decline overall, and more work needs to be done. And so I hope, Mr. Chairman, we can get support for this amendment because we shouldn't not stop now.
Thank you, Ms. Lee. Chairman Diaz-Balart.
Thank you very much, Mr. Chairman. Members, I cannot support this amendment. Now, look, the U.S. Interagency Council on Homelessness, it's done some good work, but make no mistake. You see, the program funds, that program funds bureaucrats. No problem with that. But it provides no direct service to the homeless. No direct service to the homeless. So what did we do in this bill? We prioritized funding for direct services to combat homelessness. The bill, by the way, and I hope you listen to this, the bill has $2.4 billion for homeless assistance grants. $2.4 billion. And within that amount, we provide $88 million above last year for direct services through the continuum of care providers. So again, the goal of the Interagency Council can easily be met by dedicating resources and personnel from within HUD and other agencies. I don't think we need a duplicate bureaucracy, especially when dollars can be better used, better spent, helping homeless vets, the disabled, the elderly. But there's one more point I want to bring up. Last year, the Financial Services Committee brought a housing reform bill to the floor. You all remember, H.R. 3700. It passed with a unanimous vote on the floor of the House. Unanimous vote. And that bill did not include a sunset date extension for USICH. So We all voted on that. So I don't think it's appropriate for this committee to override that unanimous decision by the authorizers just, again, not that long ago. So respectfully, I would urge a no vote on this amendment. Thank you, Mr. Chairman.
And Mr. Diaz-Balart. Mr. Price is recognized.
Mr. Chairman, I rise in support of the amendment. Would point out that it is paid for, and also that it would continue the work of an agency that is universally recognized to not only have done good work, but have done absolutely essential work in delivering housing to populations that need it. And it has some unique qualities. It's a third party. It can look across multiple agencies, find ways to improve service delivery, recommend how best to streamline various procedures. Veterans housing is probably the proof of the pudding here, as Ms. Lee has indicated. Before the ICH got involved in the HUD-VASH program, there was a HUD program, there was a VA program. They were run as if they were two separate programs. But the ICH brought them together, brought the agencies together, created a more unified and effective program. That program now serves 90,000 veterans each year. Now we're going to hopefully be tackling youth homelessness, family homelessness with greater seriousness in the years ahead. This is exactly the kind of effort for which a coordinating role will be absolutely critical. For instance, a homeless youth might interact with programs from the Education Department, the Health and Human Services, HUD, state and local programs. It's going to be essential to coordinate and to deliver these services in a unified fashion. The U.S. ICH ensures that these programs work together. It has a track record. It's not just another bureaucracy. It is a proven success. So I support its work. We all should support this amendment.
Thank you, Mr. Price. Further discussion. Ms. Pingree.
I just rise in support of Congresswoman Lee's amendment. I thank her for bringing it forward and finding a pay-for as well for what is a very vital service. And I just wanted to give a quick example of how this has been successful in Maine. In Maine, the statewide Homeless Council launched an effort through this program to house long-term stayers. Those are defined as people staying over 180 days in shelters or living outdoors within a 365-day period. So this is a chronic problem for us. Homelessness is a challenge even in a rural state like Maine. But through their initiative, the Long-Term Stayers Initiative, they've been very successful and actually brought down the number of single adult long-term stayers in our state by 73% during the years from 2013 to 2017. So I think that's just a great success story for how this program has worked. The USICH took this best practice from Maine and has been showing other states how to make similar efforts. So I just have to say, in the problems of chronic homelessness, they've been very effective. This has been a great program in our state, and I urge my colleagues to support this amendment and yield back.
Thank you, Ms. Pingree. Ms. McCullum is recognized.
Thank you, Mr. Chair. I rise also in support of this amendment. This interagency has done some tremendous work, and it does so because it brings for-profits, nonprofits, communities together, along with state, local, federal agencies to figure out how to tackle homelessness. Now, we've heard all the wonderful examples about what is going on with the VA right now, and we've been the recipient of that in Minnesota. But I just want to take a second to talk about a group of people who are homeless that quite often don't get mentioned too often, and that is the youth. In my home state of Minnesota, the most recent count in January 2017 identified nearly 1,200 homeless youth. Nationally, it's estimated 1.7 million individuals under the age of 24 that are homeless. And folks, when you meet with these young adults and you hear their stories, some of them are escaping horrific conditions. But they need a place to be safe because they're preyed upon. So I think the Link in Minnesota is a nonprofit housing provider, and it helps work with homeless youth, works with the school district, it coordinates things together. And that's part of what this agency does. It brings everybody together. The last thing I'll mention is just recently I was at a Native American-focused homeless shelter in St. Paul. And I'll tell you the hope and opportunity that those young adults were finally starting to feel, because it was one-stop shopping for them, a safe place, a a place where people focused on an education and made sure that they were safe. I support the amendment. I yield back.
Thank you, Ms. McCollum. Ms. Capter.
Yes, Mr. Chairman and members, I rise in support of in strong support of the Lee Amendment. At one point, when I was first elected, I tried to figure out why the school attainment scores were so poor in many of the schools that I represented. And in adopting those schools, I learned that one of the most important factors was that the child who entered school in September was gone by May in another school, and that thousands and thousands of children live in transient conditions where they're uprooted as many times as 3 times during the school year, and they just can't gain footing. By grade 3, we lose them. They can't catch up to their reading score. They can't read as fast, and it's a cycle down from there. So these early years are extraordinarily important. I've had personal experience with the Interagency Council on Homelessness, and it seems like a simple thing. If someone's homeless, you find them a place to stay. And if the federal government's involved, it's a long way from the local level. Honestly, to create housing opportunity at the local level by blending a whole series of resources, locally, statewide, federally, private, philanthropic, is really very hard to do unless you've actually had to do it. And then you know how very much this interagency council is needed, because they can help one another. They can help talk about sources of financing. They can also, in the situation where children are psychiatrically or, my God, now with the opioid and heroin crisis, not always able to go back to their family. In one of the districts that I represent in the greater Toledo area, we have 2,700 children who have no permanent shelter, and they're part of this transient upheaval that goes on in their lives. So I just think that we have finally created something that's working, because we have cut the rate of homelessness almost in half in some groups in our society. So I would urge the gentleman to seriously think about what's been said here, and urge all of you to support the Lee Amendment so we can make sure that no American, particularly children, suffer from
Thank you,
homelessness.
Ms.
And I yield
Capter.
back.
Ms. Lee, a minute to close.
We did vote to extend in the omnibus the council until 2018. So my amendment extends it to 2020. We voted on that, and I'd like us to consider this. And to my colleague's point about direct services, we need direct services. I'm not saying that that is something we should take off the table, because people need the direct help and services. But what the council does is really leverage our federal dollars to bring in more resources to provide not only direct services, but to help people move forward with their lives in terms of supportive services, in terms of transition housing, in terms of what they need to get back on their feet. Their record speaks for itself. When you have a council, and this is just $3.4 million, when you have a council that can reduce veteran homelessness by 47%, family homelessness by 23%, chronic homelessness for people with disabilities by 27%, something's working. And we should not stop now. We should move forward and continue to fund and extend this council so that we can leverage our federal dollars, because the private sector definitely would continue to support us in this effort.
Thank you, Ms. Lee, for your comments. Questions on the Lee Amendment? All those in favor say aye. Aye. All those opposed say nay. No. In the opinion of the chair, the nays have it. Sufficient hands. The clerk will call the roll.
Mr. Adderholt. Mr. Adderholt, no. Mr. Aguilar. Mr. Aguilar, aye. Mr. Amadei. Mr. Amadei, no. Mr. Bishop. Aye. Mr. Bishop, aye. Mr. Calvert. Mr. Calvert, no. Mr. Carter. No. Mr. Carter, no. Mr. Cartwright. Mr. Cartwright, aye. Ms. Clark. Ms. Clark, aye. Mr. Cole. No. Mr. Cole, no. Mr. Cuellar. Mr. Cuellar, aye. Mr. Culberson. No. Mr. Culberson, no. Ms. DeLauro. Ms. DeLauro, aye. Mr. Dent. Mr. Dent, no. Mr. Diaz-Balart. No. Mr. Diaz-Balart, no. Mr. Fleischman. Mr. Fleischman, no. Mr. Fortenberry. Mr. Fortenberry, no. Mr. Frelinghuysen?
No.
Mr. Frelinghuysen, no. Mrs. Granger? Ms. Granger, no. Mr. Graves? Mr. Graves, no. Dr. Harris? Dr. Harris, no. Ms. Herrera Butler? Ms. Herrera Butler, no. Mr. Jenkins? Mr. Jenkins, no. Mr. Joyce? Mr. Joyce, no. Ms. Capter? Ms. Capter, aye. Mr. Kilmer? Mr. Kilmer, aye. Ms. Lee? Ms. Lee, aye. Mrs. Lowy? Mrs. Lowy, aye. Ms. McCullum? Ms. McCullum, aye. Ms. Meng? Ms. Meng, aye. Mr. Molinar? Mr. Molinar, no. Mr. Newhouse? Mr. Newhouse, no. Mr. Palazzo? Mr. Palazzo, no. Ms. Pingree? Ms. Pingree, aye. Mr. Pocan? Mr. Pocan, aye. Mr. Price? Mr. Price, aye. Mr. Quigley? Mr. Quigley, aye. Mrs. Roby? Mrs. Roby, no. Mr. Rogers? Mr. Rogers, no. Mr. Rooney? Mr. Rooney, no. Ms. Roybal Allard? Ms. Roybal Allard, aye. Mr. Ruppersberger? Mr. Ruppersberger, aye. Mr. Ryan? Mr. Serrano? Mr. Serrano, aye. Mr. Simpson? Mr. Simpson, no. Mr. Stewart? Mr. Stewart, no. Mr. Taylor? Mr. Taylor, no. Mr. Valadeo? Mr. Valadeo, no. Mr. Visklosky? Mr. Visklosky, aye. Ms. Wasserman Schultz? Ms. Wasserman Schultz, aye. Mr. Womack? Mr. Womack, no. Mr. Yoder? Mr. Yoder, no. Mr. Young? Mr. Young, no.
Are there members who wish to record their vote or change their vote? Seeing no one, the clerk will tally. This vote, the ayes are 21 and the nays are 30. The amendment is not agreed to. Mr. Graves is recognized.